All right, now, as South Africa concludes its G20 presidency later this year, organizations and experts are calling for higher health taxes on sugar, on tobacco and alcohol products. Predictions indicate that by 2023, non-communicable diseases will account for 75% of all deaths annually, with the majority of them coming from the global south. So how exactly can this be achieved? We speak now to Professor Sue Goldstein, Director at the Wits Centre for Health Economics and Decision Science under the Priority Cost-Effective Lessons in System Strengthening in South Africa banner. Good morning, Doctor, and thank you so much for your time. Firstly, can you share your perspective on the current state of health taxes in South Africa and their potential impact on public health?
Good morning. Thank you so much for having me. Well, the current state of taxes on health products or non-health products is that none of them are high enough to really assist in preventing the harm. So, for example, tobacco is quite good, and it has been increasing over the years. And I think our tobacco legislation is relatively good. Alcohol has not increased sufficiently, and it is very easily and affordably available. And the sugar tax, which was introduced in 2018, hasn't increased at all, and it remains at a percentage of about 11%, whereas it should be at 20%.
What are your thoughts on the potential for health taxes to reduce consumption of unhealthy products and improve public health outcomes?
Well, I mean, just to be clear, the health taxes are one part of a whole. We should be looking at a whole lot of interventions. But health taxes have been shown globally in many situations to decrease consumption of these harmful products, particularly amongst poor people who are often hardest hit by the harm and often have less access to health services when they are harmed. So it's been shown globally. There are many countries who have these taxes. There are many who have very high taxes. But I think that the point is for me and for the G20 issue is this is not just a South African issue. This is a global issue. And as a world, we should be thinking about how to protect citizens from harmful products who really are only looking to improve their bottom line.
And what are the key points that you believe South Africa should champion during its presidency of the G20 regarding health taxes?
Well, the most important thing is to make sure that the taxes exist, which they don't in all countries, but B, that they help to not only to increase the prices, but also look at the content of what we're taxing. So, for example, with sugar, if the tax allows 4 grams of sugar which is untaxed, and then the tax kicks in. So what that means is that it's encouraging people to decrease the amount of sugar. So if it remains below 4 grams, if we change that, if we made it 2 grams, it would encourage reformulation. So that and for alcohol, that would make sense. Of course, with tobacco, there is no safe way of using tobacco. So that we just would increase as much as possible to make it unattainable.
And what are the potential economic benefits of implementing health taxes, and how can the revenue generated be used?
Well, in some countries, the taxes are used. Of course, it's huge. The economic benefits are huge. It comes to billions of rands or dollars in revenue that can be used for anything. In some countries, for example, in Australia, they use the taxes for health promotion. So when the introduction of tobacco taxes came in, people were worried what's going to happen to advertising because tobacco advertising was so big. And what they did was they used the excise taxes to create advertising for health promotion. So they sponsored rugby or football teams, they advertised but using health slogans and replaced and enabled the advertising industry to carry on. This could happen in many countries in South Africa, but the Treasury doesn't like in South Africa to earmark money towards health or any other thing. But we know that South Africa is so short of money, so increasing taxes really can only assist in health, education, social development, and so on.
And do you have examples of other countries that have successfully implemented health taxes and seen positive outcomes?
Yeah, so in countries like Scotland, even the UK, many countries across Europe, in Russia, they did that as well. And it's very clear that it has had a major impact on people's accessing, particularly this is around alcohol. The tobacco taxes are almost generically across the world. Sugary beverages a little bit less so, but in South America, the sugary beverages have been particularly successful.
And what are the most critical steps that South Africa and other G20 countries can take to address the commercial determinants of health and reduce non-communicable diseases?
So, well, there are a lot of steps that they can take. Taxes is one of them. I think the other step, that one big step, is to look at policies which reduce harm. And so, what happens is that industries get involved with government policy. They have a lot of input. They say, "Oh, we'll give you for this." So, for example, Coca-Cola was very involved in Zero Day in Cape Town, and then they improve. They make their brand seem good, and the country is therefore is a bit reluctant, let me say, to increase taxes or to prohibit the use of these particular harmful products. So conflict of interest is a huge issue, and I think that countries need to really look carefully about how industries are involved in policy making so that the policies are actually for health and not for the bottom line of industry.
All right. In closing, before I let you go, Dr. Goldstein, how do you think the G20 presidency can be leveraged to promote global health initiatives and address non-communicable diseases?
Well, these are countries where a lot of this of foods, tobacco, alcohol are produced. These are countries which have a lot of huge economies, and sometimes these companies that reside in these countries have economies bigger than other whole 20 countries decided that they would actually engage with health taxes. They would engage at looking at other healthy policies such as decreasing access to alcohol or tobacco, front of pack labeling for foods. If they all, it would have a huge impact on non-communicable diseases.